Bismillah ar-Rahman ar-Rahim. My dear MRCS candidate, I like always the relation between examiner and the candidate to be very easy and very straightforward. So here I have a question from one of the candidate for MRCS that the pathology AI trainer link is not working. So let's check, because usually this is a common request comes because sometimes the program is not the Google Chrome is not updated, or software of the program is not updated, or there is problem with the laptop or internet connection. But let us check it. I go to the community post, as you can see, and then let me go to the link, and here is the link for all the AI program. And let me go to surgical pathology. You can see this is the link. I will click on it. It takes maybe about 30 seconds to go to AI Studio by Google. And this program needs permission of the microphone. And you can see it has opened the program, VASAI Surgical Pathology Trainer. It gives you performance, how good you are in your last sessions. And I have put 20 pathology stations between colorectal cancer, acute appendicitis, thyroid. All these stations come in the MRCS exam part B as pathology, and they are important for you. You allow the microphone, allow access, and let us select, for example, the one of appendicitis. So here you press on start, and it will open the station. This is a specimen. How we can get this in the exam by tablet. And remember, acute appendicitis can come in the clinical examination with abdominal examination. It can come in pathology as well. And it's very important, even with the new format of multimodal, I can bring a patient with acute appendicitis and then show you with the tablet, this is the pathology, and give you a little bit of preoperative preparation. So I can test the multimodal. So here is a scenario. Examine this gross specimen of an appendix removed, 22-year-old female patient. Describe the macroscopic appearance. If a firm yellow nodule was found on the tip, show what this changed your management. So you can see this appendix. I put you roller beside it to know how many centimeters. And these are the assessment domain that I want to assess you in the macroscopic identification, TNM classification, if there was a tumor of the appendix, and clinical management plan. And the way you can test is by start here, and then the program will start listening to you. This is a specimen of acute appendicitis, around 11 centimeter, looks congested with a gangrenous tip. It needs to be examined under the microscope to see the inflammation and to exclude any evidence of tumors. And here you stop, and it will analyze your response. I've made it efficient response, did not cover much, but you can see here is assessment of your performance. I give 7 out of 20, so I have failed in this station. Remember, I've put in all my AI program to be at excellent level. So sometimes passing a station is difficult because I want to raise your level before the exam as much as I can. So don't worry, little by little you increase your level. It can also record what you have said. So here it's recording. This is a specimen of acute appendicitis. So you can listen to what you have said and answer. In the pathology knowledge, I took 2 out of 5. Your currently identified macroscopic feature include the lens. However, you failed to identify firm yellow nodule, classic presentation of new neuroendocrine tumor, carcinoid tumor. And this is important of yellow spot on the appendix. It can be carcinoid tumor. Clinical reasoning, I took 1 out of 5. You did not answer the second part of prompt regarding management of your nodule. So it was listening to me, giving you your structure and flow. 2 out of 5. Your initial description was clear, but answer was incomplete, missing address and scenario. And this is what I have done good. Accurately identify microscopic recognition needs for histology confirmation. But this, what I have missed, did not mention recognize of yellow nodule equal carcinoid tumor, failed to explain the management, did not discuss assessing of the mesoappendix or surgical basis. So you can see, and even it can give you a senior examiner advice, and you can listen to the advice. So it will convert it into a speak to give you the best answer and give you what you should answer this question.
In
And
MRCS pathology stations, always listen carefully to all prompts in the scenario. A firm yellow nodule at the tip of the appendix is a classic board question for neuroendocrine carcinoid tumor. Memorize the treatment cutoff. Less than 2 centimeters at tip equals appendectomy. Greater than 2 centimeters, or involvement of the base/mesoappendix, equals right hemicolectomy.
so you see, you can get the answer spoken to you as well. So the program is working. You can download even your report of your performance, and if you want to reset the station, you can reset the station. So program is working, and here is all the
In
stations.
MRCS pathology stations, always listen carefully to all prompts in the scenario. A firm yellow nodule at the tip of the appendix is a classic board question for neuroendocrine.
You can see it's really very good program. It make you pass the pathology quite easily, and I hope you all benefit from the program. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and examiner of the Royal College of Surgeons of England. I wish you all the best.